Okay, well, good afternoon, everyone. It is 12 o'clock on the nose, so time to start our Friday edition of the COVID situation report. Certainly lots going on, and very grateful to have you all with us today to get the latest information. Very pleased to have several of our elected officials with us today, and also members from our enforcement partners. And also members of our municipal partners as well. So I would like to start us off with a quick land acknowledgement on this spring day, which is keeping our flowers nicely watered for May. Okay. Oh, I hear there's a bad echo. I wonder if we can just make sure everyone's mics are off.
Brittany, we also can't see anything. Like it says can't display content.
Oh, okay.
I don't know if anyone else is seeing that.
I can see it.
Okay.
Yep,
Maybe I'll just exit out and come back in again. Sorry, guys.
Okay, thank you for letting me know.
Okay.
And yeah, so hopefully everyone can see this. And if you're still hearing an echo, let me know. From my perspective, I can still see everyone's mics are off, so hopefully we're okay. All right, so with that, as we gather, we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, sorry if there is still an echo. Maybe when we have another speaker off-site, it might improve a bit. Anyway, with that, I would like to invite our Board of Health Chair, Andy Mitchell, to open us up with some remarks. Please go ahead.
Thank you, Brittany. The Peterborough region and all of Ontario is experiencing an unprecedented public health emergency. The very institutions designed to protect us, our hospitals, public health organizations, frontline healthcare, are in danger of being overwhelmed. The people working in these institutions are performing heroically, and I salute them. There will be a time to dissect and understand how we arrived here, to insist on accountability, and to take measures to avoid future mistakes. However, today is not that time. Today, we need to be focused on other things. First is halting the spread of COVID in the community. The virus is not lurking in some faraway and remote place. It can be found where we shop, where we work, and anywhere that people gather. The ability to halt COVID rests with the residents of our community. Our last line of defense is not the government. It's each and every one of us. We need to stop all non-essential contact with others outside our household. We need to stay at home. We need to avoid traveling outside the area. We may not have much control over many things in this pandemic, but our behavior is one thing we do control. The rules established by government, public health, and others, and I suspect there will be more coming, only work if we allow them to work. To the vast majority of our residents doing their part, a heartfelt thank you. The second area is vaccines. They have helped to protect some of our vulnerable populations in this wave. But their larger benefit will be to avoid a fourth wave. We cannot vaccinate our way out of today's crisis. Stopping community contacts will do that. But we can avoid tomorrow's crisis by getting vaccinated when our time comes. Third, The government needs to continue providing whatever resources it can to our hospitals so that they can care for the sick, to public health, so they can help stop the spread and vaccinate residents, and to individuals, so that everyone has the financial and other resources to withstand the disruptions necessary to control this pandemic. We are a strong and resilient community. We have weathered tough times before. Now is the time to marshal that strength into a singular purpose: to stop the spread by stopping non-essential contact with others. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. And so we have some data to share with us now, including some new slides that we will be presenting on Fridays. So with that, I would like to invite Dr. Salvatierra to walk us through these slides. Please go ahead.
I'd be happy to. Hi, everyone. So as of 4:30 p.m. yesterday, there were 139 active cases, and that's 36 more than just 3 days ago. Most of these continue to be cases that are infected with variants of concern. The number of high-risk close contacts continues to break new records every day. It now stands at 421 individuals whom we are following closely. We continue to see high levels of close contacts linked to positive cases, which clearly indicates that some people are not limiting their socializing. I cannot stress enough how important it is to limit contacts and sticking within just your household members, as it not only prevents transmission of the virus, but it means that there are less people impacted by self-isolation and testing as a result. This current volume of high-risk contacts is now at the point where it could overwhelm our contact tracing resources. We have had to redeploy additional staff to assist. As of today, we will no longer be taking messages after hours or on the weekends for our hotline. We will be providing recorded information to assist callers during the week, but we've had to redeploy those nurses elsewhere to support vital public health activities. I apologize, and I ask for the public's patience as we try to get through these challenging times. The total number of local residents who have died from COVID remains at 12. Next slide, please. This bar graph shows that we are on track for another record-breaking week for new cases reported, with 72 cases or 73 cases reported so far, and we still have the weekend to go. Next slide, please. The number of active cases or outbreaks in our community remains at 7, but since Tuesday, we have declared 2 previous workplace outbreaks over, and we've had 2 new workplace outbreaks take their place. So we still have more outbreaks developing as we go. Next slide, please. Here in this slide, each line represents a case incidence rate over time. So you can see the time along the bottom, so starting in March, going till April 15th, and the purple line is Peterborough. So that shows you our case incidence rate and the way it has been increasing. We are now at 70 cases per 100,000 per week. But what we've also showed you here is some of our neighboring case incidence rates. So you'll see Durham at the top, and you can see they are well over 240, probably about 300 cases per 100,000. And then you will see also Haliburton and Hastings, Prince Edward. What I'd like you to take away from this is that even our neighboring health units are higher. The case incidence rates are higher, which is why we continue to implore Peterborough residents not to travel and to stay home. Next slide, please. Here we see our latest wastewater surveillance results in blue for the city of Peterborough, and this sampling is done at our wastewater treatment plant. And you can see that recent spike in virus detection that was detected this week, and this was done during their more recent round of sampling, and it is very worrisome because it does predict significantly more cases here in the city in the days and weeks to come. That red line shows you the corresponding daily case counts superimposed on those wastewater surveillance results. Next slide, please. Today, we're also sharing some new data that was launched this morning on our COVID-19 tracker. You will see a new tab now for vaccination, and it will take you to these data. Going forward, this tab will be updated once a week on Thursday afternoons by 5 p.m. So far, a total of 41,148 people have been vaccinated in Peterborough. And this breaks down to 38,517 receiving their first dose and 2,427 having had their second dose. These figures include people from outside of our public health unit who have come here to be immunized. In terms of vaccination coverage among our local residents, if you look at the bars, you'll see, first of all, we'll look at the pie chart first, and you'll see in the pie chart that 32.6% of our population, of our eligible population, has received at least one dose since we started vaccinating on January 26th. And depending on which vaccine, you need to be 16 to 18 years of age to be eligible. So this does not include the children and adolescents in Peterborough. The bar graph gives you a breakdown of vaccination levels by age group. So purple, one dose, green, both doses. And what you can see is that about 100% of our most vulnerable residents aged 80 years or over have received at least the one dose of the COVID vaccine. And you can see that those results for the other decades going down through the ages. Okay. Thank you for operating those slides for me. I do want to make a few more remarks. While the vaccination progress to date is good, it's abundantly clear that we all will need to do more to tame this third wave. All of our indicators show that it's proving to be worse than previous waves. We are ready to ramp up to vaccinate our full daily capacity of 2,000 residents per day as soon as we get enough vaccine. But right now, we need everyone over these next 2 weeks to stay at home and to avoid contact with others as much as possible. If we can make this a hard lockdown now, we can prevent this third wave from prolonging its negative effects on our social and mental health and our livelihoods. Now is not the time to travel anywhere except for a handful of essential reasons. These are only for medical care, such as a vaccination appointment, picking up medications and food, or going out to work if you can't work at home, or going out locally to exercise on your own or with your household members, and that's it. The variants of concern are now 60% are here, and they are 60% more transmissible, and we are finding that more of our new cases are not sure where or when they were exposed. Community spread of COVID-19 is more of a risk now than ever before. And it's not just a problem in the GTA or in the hot spots. It's a real issue for us right here in the county and city of Peterborough and in our 2 First Nations. Our enforcement partners are stepping up their efforts to ensure compliance with public health measures, but they can't be everywhere at once. We need to go back to that first lockdown last spring in 2020, when we emptied the streets and we sheltered in our homes. We need to do that one more time, and we need it now. And for our homeless population, we need to make sure that they too have a safe place with the supports they need to weather this storm. Thank you.
Thank you very much, Dr. Salvatierra. So now we will encourage our elected officials to share some comments, and I'd like to invite MPP Dave Smith. If you've got some comments to share, I'm happy to put you up on the screen. Please go ahead.
Thanks, Brittany. I really appreciate that. It is a bit of somber news that we're hearing. The infections are going up, the hospitalization is going up, the ICU events are going up. But I want to touch on a couple of things that it isn't all dire news. We can make the best of this. We can come out of this in very good shape. We have that ability. As an elected official, and I think that all of the elected officials here will agree with me, as an elected official, we're extroverts. We want to be out and socialize. We want to be out talking to people, shaking hands, doing things with our friends and neighbors. And we want to be able to do that soon. The more that we take the public health measures to heart and follow them, the better it will be for all of us, because we will be able to go back out again. We will be able to do those things. The vaccine rollout is one of those things that will help with it. Today we found out that Moderna is behind schedule, and that the 1.2 million vaccines that they promised us for this month are not going to come in. They've cut it in half. We are about 800,000 short from last month as well, but it doesn't mean that we can't get there. And when you look at the statistics for this region, the hope for Ontario was that we were going to be at 40% of the eligible population vaccinated, and we're at 32 and change, almost 33%. So we are getting there. We are moving forward. And that is a testament to Dr. Salvatierra, her staff, and everybody at PRHC that's involved in this, because they've done an exceptional job at getting people to come out and get vaccinated, at getting people to accept this and believe in it. And I want to, in previous press conferences, I've talked about the great work that Peterborough Public Health has done, and it was remiss of me not to mention PRHC as well, because PRHC has played a very integral role in this, not just for Peterborough, but for all of Ontario. They have taken a Team Ontario approach. They're now up to 48 ICU beds. They've expanded their ICU capacity, and they're doing it because they recognize they can do more to help all of Ontario. And I can't thank them enough for it. Everybody at PRHC, everyone involved with Peterborough Public Health, they have done yeoman's work. I know that we're getting to a point where they're starting to get tired, and they're starting to have a little bit of burnout. We need them to do what they have been doing. We need them to be able to continue with it. And the best way that we can help them as people in this community is to follow their advice. Wash your hands, social distance, stay home if you don't have to go out. And when your time comes for your vaccine, come and get your vaccine. Because all of these healthcare workers have gone above and beyond. They're the ones who are the glue holding this community together. And what we can do to support them is listen to what they have to say. Thank you very much.
Thank you very much, MPP Smith, for that. Okay, we also have with us Mayor of Peterborough, Diane Therian, and if you have some messages to share, we would love to hear them. Please go ahead, Mayor Therian.
Hi, Brittany. Thank you very much. Thanks, everybody. And I wanted to thank Dr. Salvatierra for taking time last night to join me on Instagram Live to talk about COVID. I think MPP Smith said a lot of things that not going to reiterate. But I know that at the city side, we're looking forward to the announcement this afternoon, potentially from the Premier's office, and we're going to be figuring out what that might mean here locally. But as was said, we're hearing the concern from medical professionals, from folks that are, seeing the impact of this third wave. So we all need to do our parts in caring for our community. It's been a long haul, we know, and we're all tired and we're all frustrated, but we're getting there. And we need to work together to make sure that we can slow this and not be, stuck in this situation any longer than we need to be. So be safe, be kind, and I'll be around for questions. Thank you.
Thank you very much, Mayor Therian. Okay, we will now open it up to our media partners, and let us start with Matt Latour from Oldies and Freak Radio. Please go ahead, Matt, with any questions.
I've got a couple questions, both for Dr. Salvatierra. I know while we don't know what this afternoon's announcement from the province is going to be, there's been kind of some rumor and innuendo that they have been talking about a curfew after seeing it implemented in Quebec a little while back. Do you think that's something that we should have here in Ontario?
That's a great question, Matt, but it's not one that I actually have the answer to. I know I had this discussion just this week with my medical officer of health colleagues, and some of them are on the provincial public health measures table. I'm not sure what the evidence shows for curfews. That would be something I would need to look up and understand better. And I'm happy to do that, but I'll just need a little time to do some homework.
And my next question had to do about the announcement that schools will be virtual once they get back from the April break this week. A few days ago, we've heard, that students would be staying at school because it's good for their mental health. And now we're seeing the opposite happening. Are you worried at all about students' mental health coming out of COVID-19?
Oh, I am, and that is one of the reasons why I am a real supporter of having in-classroom learning when it is safe. We do know that the biggest indicator of that is what the community rates are, and our rates have been climbing quite steeply. I do think we need to get them under control so that children and parents and staff feel safe going back to school. What the evidence shows is that schools are a relatively safe place for children, that they are safer in schools often than they are out at home or in the community. And so I hope we can see our local students return to school soon. And we will do everything we can to make sure that it's as safe as possible for them to do so.
Are you worried with students back at home learning now, as well as the April break as well, that we could see kind of a rise in cases because of that, like we saw over the Christmas break?
Well, whenever you have unsupervised play or the potential for things like sleepovers or visiting, I really hope that the parents are able to set the limits and make it clear to to all of their household members what is and isn't possible right now, what is risky, what is safe. It'll be safer for children to stay within their own households. It'll be safer for them to wear masks if they're playing outdoors with maybe members of their class cohorts. But right now, I think the safest thing is to stay only with household members indoors and out.
That's it for me. Thank you.
Okay, great. Thank you, Matt. Okay, I think we have Bill Hodgins joining us on the phone today. So Bill, if you've got some questions for Dr. Salvatierra, please go ahead.
One of them has to do with, I guess, the mass clinics and end of day extras. And it's my understanding there's a waiting list, and I'm just not sure what the restrictions are for that or how people can get on that waiting list.
So I'm not quite sure which waiting list you're referring to. Are you talking about for the end of day doses?
Yes.
Okay, so we do keep a wait list, and we do make sure we have enough people on that list so that if they are called at the end of day, they can get to the clinic to get the vaccine before it expires. When the vaccine is drawn up into the syringes, there's a 6-hour time limit so for that vaccine, it needs to be used up within 6 hours. And I know that, for example, when the province opened up vaccine access to our special education teachers here in Peterborough, I know that we were asking if they wanted to go onto that list. So right now, to get on that list, you need to be eligible for the vaccine, and you need to be willing to travel at a moment's notice. So you have to live close enough to where the vaccine clinic is being held to get there. And I know that's an issue for some of our county locations. So if you live in the county near a vaccine clinic, that list might be a good place to get your name onto. And you need to have a cell phone because we need to call through. And having been there and done that, essentially we go through the list and call people. And if they don't answer their phone, we move on to the next person because time is of essence. There are ways to get on those lists. We can get back to you if you want to know exactly how that happens. We are very grateful for people who are willing to go on those lists to ensure that we don't waste a single dose of the vaccine.
Thank you. And another question, and I'm not even sure if you can address this or not. Can you speak to allocations to pharmacies?
Yes, I can. We know that as of the Easter weekend, we've had pharmacies here in Peterborough that have been receiving the AstraZeneca vaccine. And I believe they had 200 doses to start, and they're getting weekly top-ups. I can't speak to how many are in the weekly shipments. We now have 4 pharmacies, and we've been told by the province that will increase. They will gradually increase the number of pharmacies, and they're using the experience and the data from our universal influenza program, where we had pharmacies delivering influenza vaccines. So there is a website. When you go to the website, if you allow the website access to your location, it will pre-populate with the pharmacies that are close to you, and that's where I go to see which pharmacies in Peterborough are now providing vaccine. I know in the first week alone that over 700 doses were administered by local pharmacies. So they're doing a great job at providing the AstraZeneca vaccine to people 55 years of age and over. And that website also tells you whether or not they're doing it by appointment and how best to contact the pharmacy if in fact an appointment is required.
What about people who register at more than one pharmacy? I had heard that possibly that is the reason why it is slow to, I guess, get a call from these pharmacies after you register.
Well, right, that is a problem, and hopefully that will get less of that. I think people might register when they don't know, if they're not given an assurance of when they have an appointment. It just might be a bit of an anxiety thing that you want to make sure you get your name in as many places as first. We are asking that if people choose to get the AstraZeneca vaccine at their pharmacy, if they have an appointment in one of our mass immunization clinics, that they do cancel. And the cancellation can be done through our call center by telephone. And we ask that because for the mass immunization clinics, we are dealing with frozen vaccines, and we only transport the vaccine in a frozen state, and we only transport how much we need. So we don't want to take out to the vaccine clinic more doses than we will need that day. So if people cancel, if they've already been immunized, and if they cancel, that opens up that appointment for someone else, but it also gives us a more accurate number for how much vaccine to take out to that clinic for that day.
All right, thank you very much. That's fine for me.
Thank you very much, Bill. Okay, let's hear from Donelda Fraser, who's joining us from the Havelock Rail. Do you have any questions for Dr. Salvatierra today? Oh, I don't know if you're still on mute, Donelda. Oh.
Sorry, no, I don't think I have any questions today. I do have, other than I have some concerns about grocery stores. I understand that the conveyor belt that you put groceries on are supposed to be cleaned in between each customer. Is that correct?
That's what I'm seeing when I go out to do grocery shopping.
Well, what happens if one of the grocery stores are not complying with that?
You can, you can always bring their attention to it, which is the polite thing to do, I think, is let them know or ask a question. Why aren't you? And then, of course, you can call us to complain, and we do follow up with the operator.
Okay, thanks. I'll be calling.
Okay.
Thank you very much, Donelda.
Thank you.
And we do have an online complaints form, and maybe one of my team members could put the link up in our chat thread so that makes it easier for you.
That's even better, Donelda. We use the online because I think given how busy we are, that's the best way to reach us these days.
Okay, thank you very much.
Great, thank you. And I see Sarah's already done that, so thanks so much. Okay, let's hear from Joelle Kovac from the Examiner. Do you have questions for Dr. Salvatierra? Go ahead.
Yeah. Could you please tell us when you feel that the 60+ age group can hope to be completed? I think there's been some changes this week in that target, and I wonder if the Moderna decreases is affecting.
Well, we actually find out on Saturdays, Joelle, what our allocations will be for the coming weeks. I was really sorry to hear the news that MPP Smith shared. Moderna has been a challenging vaccine from the point of allocations and deliveries. So it's not surprising news, but it is certainly not good news. So I will get a better sight line tomorrow following our meeting with the province on what we can expect. We have had to cancel some of our clinics because of either delays or decreased amounts. I know we've been holding off. We want to do more clinics. As I said, we have capacity to immunize 2,000 people a day here in Peterborough. We aren't operating at full capacity. In fact, we've had to close the hospital clinic and close and certainly scale back our clinics because of we can only work with the amount of vaccine that we have. So we will have to see whether we have some that we've been holding off on opening up until we had confirmation, and we'll have to see whether there are some that we have to close. But I think it's unlikely that we are going to be able to immunize all of our 60+ population by the end of April, which is what I think all of us would prefer. It's looking like that's going to take us into May. And if we have further disruptions of delivery, I don't know how much longer it will take us to get through those over 60. So stay tuned. We'll certainly be operating according to what we do know is coming our way, and we will be communicating out with the community when we have more information.
Okay, that's good. However, I've lost my train of thought. This is really, really awful. Okay, the hospital clinic. Thank you very much for mentioning that. So is it temporarily closed, or you mentioned there that it's closed? So what's happening?
what happened is we're only allowing them to run a full clinic once a week. And then they're doing smaller amounts in between, but because we just don't have enough vaccine. They have tremendous capacity there as well, as MPP Smith alluded to, but we just don't have vaccine. So right now, again, we know that our Pfizer shipment is being reduced the week of April 26th, and that's being cut by over 1,000 doses. So I know for that week, we were thinking we'd have to cancel the hospital clinic and not do a clinic at all that week. But again, we'll know better after tomorrow once we see what we have to work with.
Okay, that's really, really helpful. Thank you very much. Can you talk a little bit more about what it is to try and follow 420 close contacts? Does that mean you can't call it? I mean, you wouldn't be able to. Can you call everyone in one day? How does that? What does overwhelmed mean?
Well, first of all, you have to when contacts are identified, you need to make that first connection. So you need to reach the contact, confirm that in fact they are either high risk or low risk. So you need to make a risk assessment. There's a lot of education that goes on with that as well. If they do need to self-isolate, that there's education that goes on, so that they understand what that means. With the variants of concern, we are also asking that all high-risk contacts be tested right away. So that needs to be arranged. And then we also advise that they are tested again after 7 days from the exposure. So that needs to be organized as well. I don't believe high-risk contacts are called every day. That's something that we do with our cases, but certainly with the high-risk contacts, there are frequent check-ins that must occur. And in fact, we have had to call on Public Health Ontario. They have a centralized bank of staff who are able to assist with contact management, and we've called on them. They are helping us right now to do that. But in fact, our manager yesterday was on the phone doing the calls herself. I mean, that gives you an idea of how strained we are right now. And as I said earlier, we are going to be pulling some of our public health nurses off the hotline and pulling them into contact and case management to assist us with that.
Okay, that's all I have. Thanks.
Okay, thank you very much, Joelle. Okay, I believe I see Trent Radio on the line. So Rob, do you have questions for Dr. Salvatierra today?
Hi, thanks, Brittany. I think that everything I have has already been covered. Thank you.
Okay, great to hear. All right, let's move on to Paul Rellinger, who's joined us from Kawartha now, and hopefully no echo for you, Paul.
No, we're good now. It was a problem at my end. Thank you so much, Brittany. Dr. Salvatierra, as we watch the premier and medical health officials on TV, especially over the last month, it may be just me, but there just seems to be a more desperate sound to their voice, a more desperate look on their faces. To your credit, you seem pretty calm and cool and collected. But I want to get a sense from you. Are we at the most critical point of this pandemic as we speak right now since it began?
Yes, I believe we are, Paul. As I said earlier, we've never had as many cases or high-risk contacts. We've never, we certainly have the wastewater surveillance data that is sounding the alarm bell for what may be ahead for us in the coming days and weeks here in Peterborough. Because of the variants of concern, I think the risk for transmission in our community has never been greater. So these are both risky times and concerning times.
Like we're really at a precipice. It could go either way now in the next couple of weeks, correct?
Well, we were hoping that the April 8th stay-at-home order was going to help modulate this wave and begin and bring it down, but we're not seeing that happening. So it is concerning, a week later that the numbers are just going up instead of down. I think everyone will breathe a sigh of relief when if we see those numbers coming down.
Okay, and I had one more question, actually. It's regarding pharmacies, again, in vaccination. On the last call, you made it quite clear that people 55 and up should make an appointment with their pharmacy, and with the disclaimer that if they've already made an appointment somewhere else, certainly to cancel it. I've heard from more than a few people that they've done that, and they've been waiting quite a while for a call back. And I'm just wondering what you think might be the reason for that. Is it a lack of vaccines, or what do you think would be behind that?
I wish I had the answer, Paul, and I don't. I'm sorry. I know at this morning's meeting, so we meet every Friday morning with all of the partners that are participating in the vaccine rollout, and we do have a pharmacy representative at the table, and he was reporting that things were going very well for the pharmacies here in town, and that they're feeling really good about how much they've been able to do so far. So I don't know, I can't explain the reason for the delay, whether it's an issue with not enough vaccine coming their way, or whether it's that they're busy with other things. I know pharmacists, I'm actually quite impressed at how multitasking our pharmacists are, between, I know some of them are testing for COVID, as well as everything else they're doing these days.
So your message remains the same as it was earlier. Make an appointment with your pharmacy.
Yes, I think if you are interested, if you qualify, if you're 55 years of age or over, and if you are interested in getting the AstraZeneca, which is a good vaccine, then I'd say yes, be persistent and follow through and check that website, because as I said, we are hearing that the province is onboarding more pharmacies every week.
Perfect. Thank you so much, Dr. Salvatore. Thank you, Brittany.
Great. Thank you so much, Paul. Jessica Nisnik from Global News, please go ahead and ask your questions.
Thank you, Brittany. And I'll just let you know that there are two of us today. Trisha's on the line with me as well, and she's doing a separate story about enforcement, so she'll be coming on after me if that's all right. Hello, Dr. Salvatore.
Hello.
Hello. So first of all, how are cancellations going well? Are you getting many missed appointments? I stressed that last week for people to cancel. Are you still getting some people that aren't canceling, some no-shows?
I think it's still happening, and the only reason I say that is because I know up in Apsley, I had a message from our clinic lead there to say that they had a number of doses left at the end of the day, and part of the reason for that was that there were some no-shows. So it's happening. I think we will expect that it will continue to happen, and that we have to really build up our last-minute call numbers, that we have more people we can call upon to come in, and we're just going to keep trying to do everything we can. I know we're expecting a portable freezer to arrive. It was supposed to come yesterday. We're hoping it comes today, and with the portable freezer we'll be able to keep the vaccine frozen and only thaw it when we know for sure we have the need for it. So that's going to help as well.
Oh yeah, that sounds great. So Dr. Salvatore, I've been listening to what you've been saying about wastewater, but I have yet to report on it. So can you just maybe in simple terms tell us what you're getting out of wastewater? Are we doing tests of like our waste and seeing how prevalent it is in the community?
You got it, Jessica. It's that simple. We're testing everybody poops. And it all goes to the wastewater treatment plant, and we are testing there. There are auto samplers in place, thanks to the work of Dr. Christopher Kyle at Trent University, and he is working closely with Peterborough Utilities to do the sampling, and then they test those samples, and they're testing for the presence of the COVID virus. And that is what, and I'm not sure, Brittany, if you can backtrack on the slides there, just to bring that slide back up.
Yeah,
because what we get, they are reporting to us, and ideally we'd like to get this to be real-time reporting. We're working towards that goal, but for now we get the reports, and there you see. So the blue bars are the results, Jessica, in the wastewater, and so you can see, and the red we have superimposed. That's our data of daily case counts. So you can see that there's a good correlation between what is found in the wastewater and what we are getting reported to us. The nice thing about wastewater is that there is no testing bias. It doesn't rely on people going for testing. Everybody contributes to the wastewater results. And so it's a really great, equitable, population-based surveillance tool. And we're still learning best how to use it, but it's so far, and that's why I'm waiting to see whether the next test result is as high as the one that you see on the graph right now, whether that, does it regress back towards the mean, or are we actually in store for what looks like a tsunami to me? It is very worrisome. So we'll have to wait and see whether it's just a sampling error or whether it in fact holds true. But nonetheless, it is quite concerning.
Thank you for explaining that, Dr. Salvatierra. I believe that's it for me, so I'm going to pass the mic over to Tricia. Thank you.
Okay.
Hi, Dr. Salvatierra. Thank you so much. As Jess mentioned, I'm doing a story on enforcement, mainly about those anti-lockdown rallies we have been seeing. I was hoping to get a quote from you, from our police service and Mayor Therrien, if possible. Just what are you all expecting to see this weekend? Any concerns, anything within that topic?
Well, I certainly can understand, that 15 months into this pandemic, people are getting weary. And I certainly understand, the toll and the sacrifice that this pandemic has taken on everyone, especially our business community. But nonetheless, the public health measures are in place because they make sense. They are based on evidence, and they are what we need to protect us. So with that, I'm going to see, I believe our police services are with us today, and ask if they would like to comment on the enforcement plans for the protests for this weekend. So I'll just...
Yes, we do have Chief Gilbert on the line. I wonder if he would be willing to share a few more remarks with us.
Afternoon. Not sure if you can hear me or not.
We can hear you. We don't see you. It looks like it's dark.
How's that?
Oh, there we go.
Okay.
Now we see you. Go ahead.
Well, we are anticipating an anti-lockdown protest on Saturday. That's what they've been advertising for the last several weeks, that they're going to meet every Saturday. That being said, we're not going to talk about what our plans are centered around that, or any enforcement activities that we're intending to engage in, if any at all. And of course, enforcement depends on how people behave. We've heard quite candidly from Mayor Therrien, MPP Smith, and Dr. Salvatierra that all the things that we need to do to stop the spread. And quite honestly, these anti-lockdown protests are doing nothing to stop the spread. I understand people are frustrated about how long this is taking to resolve. However, as we saw with the Severn Court outbreak, it wasn't 56 or 58 people that all showed up at Severn Court at the same time and tested positive for COVID-19. It was more likely one person traveled there with it and spread it to everybody else. And that's exactly what you could see happen at one of these protests. Somebody travels there with it, spreads it to everybody else. And as we know, COVID can't get from here to there unless it travels on somebody. And the best way to stop the spread is to stay at home and don't travel, and follow the advice of all the health professionals that know what they're talking about, that are doing their best to keep the rest of us safe and healthy. So follow the rules. That would be my advice.
Thank you very much, Chief Gilbert. So Tricia, I believe you also were hoping for a comment from Mayor Therrien as well?
Yeah, that would be great.
Okay, if our mayor is able to put her screen on, I can certainly spotlight her as well. There we go.
Thank you. I know that, again, we're, have announcements coming this afternoon. So with regards to the protests that are happening, we're just working with, with the police on that enforcement piece. But again, myself isn't the one with the power to do that enforcement. So our health unit and police have been working together on that front. But we just want everybody to stay home. We understand the frustration for sure. But engaging in these kinds of protests is contributing to spreading of COVID, and is just going to keep us in this situation longer. So that's what I'll say about that for now. Thank you.
Thank you very much. Okay, any other questions, Tricia? And then we'll give Joelle a chance to ask her question.
Nope, that's it for me. Thank you all. I appreciate it.
Okay. So did you have a question, Joelle?
Yeah, I wanted to ask the mayor. I understand that the city's got no powers of enforcement, but do people not have to ask city permission to use city property for rallies? Like, where does that stand?
So my understanding is that the reason people use Confederation Park is because that is the location where you don't, which is why we often see protests at Confederation Park. If it's other parks and public property, then generally there's a permit required, but not at Confederation Park.
Okay, thanks.
Okay, thank you very much. So then I think the last media guest we have is Reg Watson. So do you have any questions for our speakers today, Reg?
No, thanks.
Okay, great. Well, then I think we've reached the end of today's media briefing. Thank you all for joining us today, and do stay safe out there. Please stay home, and we look forward to seeing you back here on Tuesday. So have a great weekend and stay safe.
Thank you.
Thanks, everybody. Have a good weekend.
You too. Thank you.